Blood clots deeply inside your leg, it does not always produce some kind of pain sensation, and that is why makes him so dangerous in today's modern world. A blood clot in your legs, and exactly is why it's dangerous. Because every year hundreds of thousands of people develop deep vein thrombosis, and many of them ignore the first signs. Some feel only mild swelling, some think it's just a muscle strain, and some feel nothing at all. And then one day the clot moves, and when a clot travels to the lungs, it can become fatal within minutes. So today I want to show you first clear warning sign your leg may be giving you, because the body whispers before it screams. And this is one of the most serious conditions in today's modern world, because this is one of the major reasons why people die suddenly. After blood clot removes from your veins, it can go upward directly to your lungs, to your heart, and you can get a heart attack, you can get a pulmonary embolism, one of the serious conditions in the modern world. The real problem and what is happening inside, a blood clot in the leg usually forms in the deep veins of the calf or thigh. And those are large veins responsible for carrying blood back to your heart against the gravity. And every step you take pushes blood upward through those veins. Small valves inside them prevent blood from falling backward. And when a clot begins to form, even a small one, it partially blocks the upward flow. And blood starts to move more slowly. Pressure rises inside the veins, and the vein stretches. And this stretching irritates the inner lining on the vessels. That irritation triggers inflammation, and circulation slows oxygen delivery to the surrounding tissue decreases. Cells in that area begin to function under stress, and the body responds by sending inflammatory signals. Fluid starts leaking into surrounding tissue, and that fluid buildup creates swelling. The increased pressure also compresses nerves around those problems, and in many cases not just the vein and the blood clot is problem. In the many cases those inflammations goes around those blood clot and put pressure on your nerves, and you get nerve also inflammation. The first sign that you have developing blood clots in your leg is gonna be swelling in one leg only. If one leg suddenly becomes larger than other, especially in the calf or thigh, that is never something to ignore. Clots usually affect only one side, and the swelling may appear within hours or gradually worsen over a day or two. Your sock may leave a deeper mark, and you may suddenly feel tight only on one foot. And the skin may look stretched or shiny. This happens because blood cannot return normally to the heart, and fluid begins to collect in the surrounding tissues. The limb becomes visibly fuller, and when swelling is clearly one-sided, it is serious vascular warming sign. Second, a very important sign that you developing blood clots in your legs is gonna be cramp-like sensation. You feel like you're having a cramp, but this is not a normal regular cramp. Usually when you have cramp in your legs, after stretching, maybe a little bit of walking, those cramps go away, but not when you have blood clot deep in your veins of the leg. Feel like you have muscle cramps, but they don't go away with no stretching, no walking. Third symptom is going to be warm skin over one area. If one part of your legs feel warmer than the rest, that warmth is not accidental. It reflects inflammation in the veins, and the body increases blood flow to the area as part of immune response. When you touch both legs, one may feel clearly hotter, and the warmth combined with swelling and the pain strengthens the suspicions of the clot. All of this is very serious signs. Sign number 4 that you're developing blood clots in your leg is going to be red or redness around the blood clot formation deep in your legs. The skin may appear red or darker than usual, and sometimes it looks slightly purple or bluish. And this happens because blood is pooling instead of flowing smoothly. And the discoloration may follow the path of the vein. In more advanced cases, the color may spread over a large area. An unexpected color change in one leg should be always evaluated. And fifth symptom is going to be fatigue in one leg or heaviness. Many patients describe it simply, my leg is just feel heavy, no sharp pain, no dramatic swelling, just heaviness. This heaviness often worsens during the day and improves slightly when your leg is elevated. It is frequently dismissed as tired muscles. But when circulation is impaired, oxygen delivery drops and the muscle fatigues move more quickly. This is unbelievably important information. And those 5 signs usually mean that you're developing blood clotting in your legs. As I said it 1,000 times before, please, this is one of the serious diseases of modern world. People dying just in a couple of minutes after blood clot remove themselves from the leg. Why this is so dangerous? Blood clots do not always produce clear warning signs. In fact, many people feel almost nothing at first. And study shows that 30 to 40% of people do not recognize deep vein thrombosis until serious complications appear. The clot may remain silent in the leg. Mild swelling may be ignored. A cramp may be misunderstood. But the real danger begins if parts of that clot breaks free. When a fragment travels through bloodstream, it moves towards to the lung. If it blocks pulmonary artery, oxygen exchange is suddenly disrupted. The lungs cannot deliver oxygen properly, and symptoms may appear abruptly. Sudden shortness of breath, sharp chest pain that worsens the breathing, rapid heartbeat, dizziness or fainting. Also, coughing, sometimes with blood. When you see all those signs, or maybe a couple of them in your lungs may be developing pulmonary embolism. This is also unbelievably important information. After 26 years working with the patient that have all those chronic problems with their vein, circulatory problems with your deep vein thrombosis, one thing is 100% clear. When you live a healthy lifestyle, when you using only 100% organic, perfect natural remedies, when you eat healthy, you remove those chances that you develop in deep vein thrombosis to the minimum. And if you're watching me right now from any country in the world, you can call my office on right now because I work with the patients all around the world. And if you have a chance, or maybe you developing all those problems with deep vein thrombosis or any kind of similar conditions with your heart, with your blood vessels, call my office. I'm gonna give you my personal medical consultations and my special MarioLab nutritional program that will help you to get healthy in the safe and natural way. My dear viewers, thank you for following me. God bless you. God bless your family. See you in the next video. Bye bye. My name is Mario. I am European medical professional with over 26 years clinical experience working with the patient all around the world. My core expertise include nutrition, natural medicine, physical therapy and rehabilitation. Through my MarioLab natural healing programs, I have helped thousands of people every year improve their health, regain mobility, reduce chronic pain and chronic diseases, and restore the quality of life. And those programs may help you as well. If you would like to visit my clinic in person, or if you prefer my personal phone consultations without traveling, my team and I are here to help you. Contact us via Viber or the WhatsApp at the phone number +385 98 9179 200. Your health deserves serious, professional, and individual approach. Thank you for following me. See you next time.